Well, Sky News can reveal one of Australia's largest Aboriginal health services will cease taking new patients immediately over a funding row with the federal government. Let's go live now to Matt Cunningham in Darwin. Matt, this is an exclusive story and it has huge ramifications. Why are they taking this action?
Well, Laura, the Danila Dilba Health Service basically runs 7 clinics across the Greater Darwin region that look after Aboriginal people who not only live in Darwin, but also those who travel into Darwin from the dozens of remote Aboriginal communities in the Northern Territory. Now, they've been locked in this funding row with the federal government for 5 years now. They say that they're only funded for those people who have a permanent residential address in the Greater Darwin area, yet a huge number of the patients they're treating, many with chronic illness and underlying health conditions, actually come from outside of that region. So they're now taking this drastic action. They're saying that effective immediately, Danila Dilba Health Service will take no new patients, and from July 1, they will not treat any patient unless they or their partner come from or have a permanent residential address within the Greater Darwin area. I've obtained a letter that was sent by Olga Havnen, the CEO of Danila Dilba Health Services, to the Federal Health Minister Greg Hunt yesterday. That letter says, with immediate effect, Danila Dilba Health Service has now closed our books to new clients for primary healthcare and will implement a transition plan and referrals for visitors and transient clients to other providers, including Royal Darwin Hospital and Palmerston Hospital emergency departments and bulk billing clinics. This decision will affect approximately 3,000 visitors from remote communities who, from July 1, 2021, will no longer be able to access primary healthcare services at Danila Dilba. Danila Dilba goes on to say in that letter that it didn't want to take this action. It knows it will have an impact on those Aboriginal people looking for health services in the Greater Darwin region, but it says it's had no option.
Yeah, indeed, Matt. Look, this is going to have big flow-on impact there. What kind of impact are you going to see in that area, particularly given that this service, as you've just laid out, really provides so much to many of the locals?
Well, I think the biggest impact, Laura, is going to be on the top-end hospital services and the public health system. You see in that letter from Olga Havnen, she's saying that Danila Dilba will now direct those patients to either a bulk billing GP clinic. I can tell you there's not a lot of those around in the top end, or an emergency department at the Royal Darwin or Palmerston hospitals. Now, those emergency departments are already overwhelmed, particularly at Royal Darwin Hospital. We've seen stories here in the past couple of weeks of ambulances banked up, of people double bunked in the emergency department. So if you add another 3,000 high-risk Aboriginal people with chronic health conditions to the workload that's already being taken by the Royal Darwin Hospital, well, you're going to see a huge amount of pressure placed on that particular facility. Remembering, Laura, that it's only a few weeks since the Northern Territory government had to go to the federal government and ask them to stop those repatriation flights coming from India because it was worried that its health system, its hospital system, in particular the Royal Darwin Hospital, would be overwhelmed if there was an increase in those coronavirus cases. So, you know, this decision from Danila Dilba could have huge ramifications across the board.